Welcome back. We are now moving towards the close of this 2021 World Cancer Leaders Summit. And the last discussion panel of the 2021 summit will focus on innovative partnerships and how they can make change happen. This session will be moderated by Darian Stibbe, Executive Director of the Partnering Initiative. So I hand over to you, Darian.
It's a huge pleasure to be here, one of the last sessions of the conference, which has clearly been going extremely well. So I am Darian Stibbe, I'm Director of the Partnering Initiative. We're an international NGO dedicated to driving effective partnering to deliver sustainable development. And we've had the great pleasure of working with the UICC, particularly around a publication, Better Together, a guide to partnering with business to tackle NCDs. Now, the reason why I got into partnerships nearly 20 years ago or so was because partnerships, to me, are a form of alchemy. They are a way where you can seemingly create value out of nothing. And bringing together the resources, all different kinds, public, private, people, academia, basically it's around delivering more than the sum of their parts. How can 1 + 1 equal 3 or 5 or 20? But before we get going in this discussion, just a quick definition around what we mean by partnerships, because it's a word that's used basically for multiple different types of arrangements. So I just want to distinguish 3 different types of partnership. And the first one, which is sort of the more sort of transactional partnerships, which we are sort of almost like leveraging partnerships, where we find another organization that's willing to contribute to our organization, some resources. It might be finance, it might be a business funding something that an NGO is delivering, but it's sort of this transactional interaction. Now, the second level of partnership, that starts to get a little bit more interesting, because then we're talking about how do we combine and integrate what can be unique resources that different sectors of society can bring to deliver something new, something that we couldn't do on our own, something more innovative, more efficient, more effective, more sustainable, potentially. And then finally, the third level is when we're actually looking to deliver system transformation. When, for example, when we want to transform the health system in some way to permanently deliver better cancer diagnosis or treatment or education by bringing together the unique resources of all sectors of society. So bringing together government policy and regulations, its public sector health infrastructure, together with the power of civil society to reach people and engage with people, together with the marketing reach of business or the products and services and innovation that business can bring to the table, along with the research and evidence that academia can also contribute. And if we're clever, if we can collectively bring together these different unique levers, we can genuinely push the needle. Now, in all of these cases, it's the diversity of the resources and thinking that allows us to deliver far more innovatively. And that, of course, is the subject of today's session. It's about partnerships that are delivering things in new ways. And we have 4 extraordinary people who are running really very innovative partnerships that are genuinely delivering real impact and change. What we'll do is we'll first hear about the partnerships themselves, and then we'll talk a little bit about what it takes to make them happen. And we're going to start with Hayley Jones, who is the director of the McCabe Centre for Law and Cancer, which is in Australia, which was actually a partnership itself originally, a partnership between Cancer Council Victoria, Cancer Council Australia, and the UICC. And we're going to hear how the centre is using partnerships to promote the effective use of law for the prevention and control of cancer and other NCDs. Unfortunately, Hayley couldn't be with us today because she's in Australia, and so we're going to show a video of her remarks. Thank you.
Hello, I'm Hayley Jones, and I'm the Director of the McCabe Centre for Law and Cancer, speaking to you from Melbourne, Australia. I'm grateful for the opportunity to share with you about innovative partnerships and how they can be an engine for change. We are actually thinking a lot about this topic at the McCabe Centre. With our 10th anniversary coming up on World Cancer Day 2022, we have been reflecting on our history and the impact that the McCabe Centre has had on tobacco control laws, health system regulations, and all sorts of cancer control policies. And it is clear that the story of how a small team of McCabe Centre lawyers based in Australia, Fiji, Kenya, and the Philippines, has been able to make an impact on laws and regulations around the world is really a story about the power of people partnering to make change. When we say that innovative partnerships are the McCabe Centre's foundation, we mean it literally. We are a joint initiative of 3 partners: Cancer Council Victoria, the Union for International Cancer Control, and Cancer Council Australia, who all took a risk by creating something that had never existed before, a centre focused on using law to prevent and control cancer. Law might not seem like an obvious tool in the fight against cancer, but when used well, law can be harnessed to improve the health of millions of people, all in a very cost-effective way. That was Cancer Council and UICC's vision when they launched the McCabe Centre in 2012, and their leadership has shaped our work immensely since then, opening countless doors and connecting us to other key partners along the way. Together, we built a world-renowned capacity building program, and through that program, we have joined forces with more than 270 lawyers and policymakers from 77 mostly low and middle income countries. We call these McCabe Centre alumni, and supported them to implement and defend cancer prevention and control laws in at least 24 countries to date. For example, our alumni have contributed to a comprehensive tobacco control bill in Jamaica, played a key role in the adoption of alcohol control laws in Vietnam, and have been part of the legal team leading Brazil's landmark lawsuit against tobacco companies to recoup money spent on public health care for tobacco-related illnesses. Partnering with the Secretariat of the WHO Framework Convention on Tobacco Control in 2014 led to us to become the first ever WHO FCTC Knowledge Hub, an innovative model that has since been replicated with 7 more knowledge hubs around the world. We also partnered with the World Health Organization and were designated the WHO Collaborating Centre on Law and Non-Communicable Disease in 2018, and have since worked with many member states to share legal expertise. Our partnerships are mutually beneficial in so many ways. We are always learning so much from our partners and alumni to ensure that our efforts are well directed. And we are proud to assist our partners and alumni to showcase and support their work. The pandemic has shown us more than ever how interconnected health is with the economy, environment, politics, trade, justice, equity, and so much more. To reduce the global cancer burden, we need to keep looking outside our silos and draw on expertise across a wide variety of sectors. My challenge to you is to think outside the box. Who are the unusual suspects who can help achieve the change that you want to see? Looking within and beyond the health sector, how can we work together to reduce the cancer burden and leave no one behind? My trip to the World Cancer Leaders Summit in Kazakhstan 2 years ago really highlighted the value of these unique cross-sector partnerships. I have such fantastic memories of gathering with an inspiring range of leaders and advocates working in dramatically different contexts, united by the same goal, reducing the burden of cancer around the world. Meeting and learning from such leaders showed me that the true power of the cancer control community is the people who work together towards a greater good. It's the people who are participating today, setting a course for the future of cancer control, and the people working on the ground to bring about change. Thank you for your time, and I can't wait for us all to gather again in person really soon.
So we know that NCDs writ large are everybody's problem. Health services on their own simply cannot solve these issues, and we do need to collectively bring together all sectors of society to be able to, as Hayley said, work together to reduce the cancer burden and leave no one behind. Well, Katie Dain, who's our next speaker, is the Chief Executive Officer of the NCD Alliance, and Katie is globally recognized as a leading advocate and an expert on NCDs. And Katie, tell us a bit about the NCD Alliance, how you as a global partnership are able to drive innovation and impact, transforming the fight against NCDs.
Thanks very much, Darian, and great to be joining you all today. So I thought I'd briefly talk a little bit about the NCD Alliance, but then also share a very specific example of an innovative partnership that we've recently launched. So firstly, about the NCD Alliance, as a global alliance and membership-based organisation, partnerships have obviously been, very integral to how we work day to day. Our approach has always been about uniting and combining the expertise and reach of our members and partners on issues that collectively we can achieve much more than any one single organisation can. And today our 300 strong membership spans the whole NCD community across diseases, risk factors, demographic groups. And we partner with 30 supporters across different sectors, governments, NGOs, academia, relevant private sector. And I think what's quite interesting, 2 points, is that our alliance model at the global level has very much been translated down to the national and regional level, with a fantastic network of 60 national and regional NCD alliances currently operating today. And also, we've just finished our strategic planning for the next 6 years, just launched our new strategy. And what we have decided is that really we've positioned partnerships as a core function and a pathway to our work in this next phase. Previously, it was very much an enabler. But now we're really positioning it as very much front and center of our strategy. And that the NCD Alliance not only is about building partnerships to support our own strategic goals, but also providing guidance and support to our members in terms of what effective partnerships actually looks like. So just finally, just to give a concrete example of an innovative partnership we've recently launched. If you rewind to early 2020, when the COVID pandemic was unfolding, and we were seeing people living with NCDs very much being at the epicenter. And we were also seeing the beginnings of this huge impact that COVID was having on our community in terms of the financial impact on civil society and the impact on our ability to do advocacy with travel restrictions and digital ways of working. So the NCD Alliance back in the beginning of 2020 moved very quickly and set up a Civil Society Solidarity Fund on NCDs in COVID-19. It was the one of its kind. We aren't aware of any others that were set up during this period. And we raised over 600,000 for 2 years, supported 39 national and regional NCD alliances during 2 phases with small grants to really support their work on NCDs in COVID. And I think what's particularly interesting in terms of the innovation of this partnership is that it took shape and it came together very, very quickly. I think sometimes with partnerships, they take a very long time to unfold. During an emergency, it was obviously essential that we move very quickly. It was based on a very clear need. The whole approach of the Solidarity Fund built on the NCD Alliance's experience and expertise in capacity development. We weren't reinventing the wheel. We managed to raise, significant funds during a time of great uncertainty and financial instability, really against all odds in a way. And the partnership model was very much about pooled funding. So it was about bringing together some of our existing supporters who saw the need and the opportunity and the urgency and came together to support this fund. And most importantly, I think we set out some very clear metrics to measure our success and our impact. And I think that's my last point, just really kind of reinforcing the importance of measuring the impact of our partnerships, whether we're doing them at global level, regional or national level, having very clear metrics around success and impact.
Thank you so much, Katie. I think the partnering during COVID-19, as you mentioned, we've seen it in all sorts of different sectors, how suddenly it was accelerated. And you have given some really clear reasons why. The fact that you're looking at things that are needs-based, based on experiences already to date. But that other point you made about the clear metrics, so important in collaboration and partnerships to be able to understand exactly what success looks like, exactly how by working together we are able to deliver more than the sum of the parts. I'll ask you some more about that in just a moment. Before then, moving from one fund to another, Dr. Hayat Sindi is the Senior Advisor to the President of the Islamic Development Bank, and she works on science, technology and innovation. And Dr. Sindi is a highly renowned biotechnologist and a global champion of science and technology. Now, in 2019, the Islamic Development Bank and the IAEA launched a joint women's cancer partnership initiative to support member states to expand breast and cervical cancer control programs. And of course, it's all about innovation. I wonder if you could tell us a little bit about the fund, but really about the innovation that this fund is sparking.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Good morning, good afternoon, everyone. I'm here in Dubai from Expo. Thank you very much for letting me part of this very important session about partnership, SDG number 17, and especially innovative type of partnership. The incidence of breast and cervical cancer within very high within the middle and low income countries, and especially in the Islamic Development Bank member countries. We lose every 50 seconds a woman for breast cancer, and we lose every 90 seconds a woman for cervical cancer. And that's not fair. And especially the woman could die from treatable and curable type of cancer, and especially if we know as well the amount of the cost of the vaccine is quite is not that expensive. Both IAEA and Islamic Development Bank for a decade been joined together to help to control cancer and make access to low and middle income countries to diagnostic. But we realized that there was an urgent need to establish that further. So we established a fund called Saving Women Lives from Cancer. It's a $500 million fund, and the whole fund is structured in a very innovative way for three main reasons. The first reason is, of course, you talk about all the level of partnership, and I like the introduction very much, Darian. And instead of just having donation for something, like we need to really involve the private sector. So we have this type of Islamic blended finance based on 5 Ps: partnership between public, private, philanthropy, people, civil society type of partnership, when we involve all stakeholders of society, government, private sector, civil society, philanthropy. So anybody in kind or putting direct money in the fund or training or donation, we part of this fund. The second part of this innovative fund, we did an amazing and comprehensive study for 17 countries, IAEA and Islamic Development Bank. Why? Because we wanted to create a bankable project prior establishment of the fund, because a lot of funds are established and then it's very hard to find a bankable project that they can straight away invest in. So that the disbursement is sometimes years and years there looking for a good project. But what we did, working with government, working with our Ministry of Health, and we selected 17 countries, varies between low and middle income countries like Bangladesh, Uzbekistan, Cote d'Ivoire, Djibouti, Sierra Leone, Bangladesh, Malaysia, and so on. So for example, with Bangladesh, when we did the bankable project, can benefit 9 atomic and cancer institute. They're going to help 5 million women for screening and diagnostic. The third part of this type of fund, the innovative way, is we link innovation. We sponsor also innovation by we set up with the IAEA call for innovation when we challenge and ask the scientists, the research institution around the world to come with an innovative idea for 2 categories. One of them, how we can find low-cost diagnostic to kind of screen massive number of for cervical and breast cancer. The second one is how we're going to link, as you mentioned, about transformation, how we can have capacity building and help the infrastructure of the health system within a country. And Darian, the amount of innovation from the local communities are really amazing. Being poor doesn't mean you're not smart and have innovative idea. For example, one of the idea we're sponsoring this year, and I hope to also to announce the 4 winners for this year, is a scientist from Senegal. He found that the social stigma is still a problem to make awareness for women to go and diagnose and screen for cervical and breast cancer, especially also the young girls. So what he did, he electronically using digital platform trained midwives who have access to, of course, a lot of female, to train them how to register cases, how to clinically provide explanation, how to screen, and will be reaching about 100,000 women in Senegal. So that's the part of partnership we are setting up with the IE for this for this fund. It's called Saving Women's Life Fund.
Thank you so much for giving such a clear view explanation of your fund. I love the fact that innovation comes from multiple places. The fact that innovation for low-cost diagnostics can come from companies, for example, but so much coming from the local communities. And I think that's where we see so much success for global partnerships or national partnerships, is when they really do engage with the people on the ground. Moving then to our fourth panelist, Sue Henshall. And Sue is the CEO of the City Cancer Challenge. And what's interesting about the City Cancer Challenge, well, there are multiple interesting things, but one of them is that along with the NCD Alliance and the McCabe Centre, it was born from the UICC. It was the idea was sparked there, and the UICC really helped to incubate these partnerships. Now, as I was talking about, so much good action, good partnership can happen at the country or the local level, and City Alliance, of course, works at the city level. Sue, can you tell us about your approach to partnership building, particularly with the private sector? Because this sometimes it's a challenge when trying to work with the private sector, but that's also where innovation can come from. So I wonder if you could just tell us a little bit about that, about the innovation that CCAN creates, particularly with the private sector.
Thank you so much, and it's a pleasure to be here today. I think your question about bringing in partners that are not transactional, starting with that statement that you made at the beginning, that partnerships really need to be about sustainable action. And they need to really address issues at the systems level. And obviously, at CCAN, where our purpose is to support cities as they work to improve access to equitable and quality cancer care, everyone realizes that level of partnership has to be very much inclusive. But it has to be deep, it has to be meaningful and effective. Otherwise, the aims and the objectives of the organisation, frankly, but also of what the cities are trying to achieve just can't be done. And the CCAN takes the approach from the very beginning that the private and public sector both have a strong role to play, really beginning from due diligence. When we start working in a city, we look across the different spectrum of stakeholders, who's providing care, who's supporting initiatives in that city. And as you said, it can be really about bringing that public and private sector together. The first way we do that in CCAN is through the City Executive Committee that's formed in every city that we work in. It's a really clear example of innovative partnerships, because often these individuals are working at a high level. They're working at a multi-level in terms of governance. So they may be representative of the city, the municipality health, they may be at the regional level, and they may also be working at the national level. But they're coming together in this 12 to 15 member group who become the stewards, the real decision makers of the program across the 2 to 3 years that we're working with cities. And this group of people, they may know each other, they may even work together. We've had instances where they actually work together down the corridor. But, people are busy and people have their own work to do, and really CCAN creates that platform. it creates that momentum and the catalyst for bringing people together around a table and aligning them, around a common interest. And, this alignment of interest is really what's critical to be bringing different sectors together. We've heard all the speakers talk about the importance of bringing multi-sector partners together. But that has to be through trust. It has to be through an alignment of interests and building trust, and also very much about really building confidence between those individuals and those institutions.
Thank you so much. So alignment of interest, building trust, building confidence, building the relationship among the various institutions. Quick question for you on working with the private sector, because we often find that people are very reticent to do so. You mentioned something about due diligence, but how do you prevent the risks that we associate with working with the private sector? How do you mitigate those risks?
I think that you talk about risks, we talk about opportunities. So I think that the approach that CCAN takes to public-private partnership and any multi-sector partnership, it doesn't have to be public-private, it's any group of private, public, associations, health professional groups coming together, really building, as I said, the trust, but also understanding that there are potential conflicts, there are perceived conflicts, but if individuals and institutions come to that table and understand what each other's interests are, what each other's agendas are, we have a constructive engagement framework that we provides the principles and the framework for partners to come together. And as I said, it's about alignment of interests. It's about making sure that we are there, we're doing the right thing, we're doing it the right way, and we're doing it together. And when everyone understands that and is working towards a single outcome, yes, there will, by nature of partnerships, there will always be areas where you need to address. But that is something that can be very positive. It's a positive narrative between partners to understand potentially where those conflicts might lie, but not to think of them as a barrier to moving forward, because there are always ways that partners can work together.
So thinking less about conflict of interest and more about alignment of interests, if ultimately the goal of the partnership delivers better healthcare outcomes, then it is very much this alignment of interest. So we have a couple of minutes left. I just want to get from each of the panelists, what is your one key piece of advice to people who want to go out and develop sort of more innovative partnerships? So one key piece of advice. I'm going to start with you, Katie.
Sure. I liked your description at the beginning there, Darian, about transactional to transformative, and I would also add sustainable, as Sue said. I mean, I think with all partnerships, we need to be looking at the short-term gains and the short-term impact, but having a long-term view in all of our partnerships and tackling the big systemic issues that we're all trying to change and shift. And I think with all partnerships, it's useful to have a clear kind of specificity of purpose and to bring the right partners around the table. There's many different actors out there for NCDs, but we really need to be thinking about which are the right types of organisations, sectors to be bringing in on this specific partnership. And then, as I mentioned earlier, kind of really clear metrics of for impact. I think that's one piece that we've slightly been lacking in the NCD community, kind of really measuring and actually trying to understand what's worked and what hasn't worked in partnerships and sharing those best practices across the community.
Thank you so much, Katie. Dr. Hayat, you've got 20 seconds. In fact, 15 seconds.
Okay, I think with partnership, there is a powerful collaboration between North-North and North to South, because we consider even the local innovators are partners. So in any partnership, my advice, always think with your partner how to be creative for mobilizing resources, and you need to be innovative to find solution to any challenge. And that's the power you get from the collaboration from all levels of society and from different parts of the world. You cannot be in isolation. You need to have South-South, North-South, South-North type of collaboration. There's a power there.
Wonderful. Thank you very much. I'll take creativity and innovation. Sue, you have -5 seconds.
Make sure you bring together partners with complementary resources and expertise. There are partners out there, there are organizations out there that bring different efforts, different perspectives, different resources to the table. Bring them to the table, because what we see is global coordination of partnerships is key. You know, bringing different people together to solve a problem is the way to go.
Thank you all very much indeed for your brevity there. Thank you all for all of your insights. Clearly, collaboration and partnership is an essential approach if we are going to try and shift systems, if we are going to achieve innovation and real impact. I'd like to thank you all very much. Hayley Jones, Katie Dain, Hayat, Sindi, and Sue Henshall. Back to the studio.
Thank you very much to you, Darian, Stibbe, and also to your panelists as well.